Hello and welcome. Today we're diving into the world of the urinary system to explore a condition known as renal trauma. Renal trauma refers to injury to the kidneys, and it's a serious issue that can have significant consequences for overall health. Join us as we uncover the causes, symptoms, diagnosis, treatment more to better understand this complex condition. So, what causes renal trauma? The most common cause is blunt abdominal trauma, frequently occurring in car accidents, falls, or sports injuries. Penetrating trauma, such as gunshot or stab wounds, can also directly injure the kidneys. Additionally, pre-existing kidney conditions like hydronephrosis or kidney tumors can make the kidneys more vulnerable to injury, even from relatively minor impacts. Finally, iatrogenic causes, meaning injuries during medical procedures like biopsies or surgery, are also possible, though less frequent. Let's delve into what happens inside the body when renal trauma occurs. The pathophysiology of renal trauma varies depending on the severity and type of injury. Blunt trauma can cause contusions, lacerations, or even complete rupture of the kidney. Penetrating trauma often involves direct damage to the renal parenchyma, blood vessels, and the collecting system. These injuries lead to bleeding, both within and around the kidney, potentially forming hematomas. Depending on the extent of the damage, the injury can compromise kidney function, leading to issues with fluid balance, waste removal, and blood pressure regulation. Damage to the collecting system can result in urine leakage, causing inflammation and further complications. Understanding who is affected by renal trauma is important. Epidemiologically, renal trauma is relatively uncommon compared to other types of trauma. However, it's seen more frequently in young males, primarily due to their higher likelihood of being involved in high-impact activities and motor vehicle accidents. The incidence also increases in urban areas with higher rates of violence. It's important to note that individuals with pre-existing kidney conditions are at a higher risk of experiencing more severe outcomes from renal trauma. How does renal trauma present itself? The signs and symptoms of renal trauma can vary significantly depending on the severity of the injury. Common symptoms include flank pain, which is pain in the side of the abdomen and back, hematuria, or blood in the urine, which may be visible or only detectable under a microscope. Bruising or swelling in the flank area may also be present. In severe cases, patients may experience signs of shock, such as rapid heart rate, low blood pressure, and altered mental status. It's crucial to seek immediate medical attention if you suspect renal trauma, as delayed diagnosis and treatment can lead to serious complications. Diagnosing renal trauma involves a combination of physical examination and imaging studies. A thorough physical examination will help assess the patient's overall condition and identify any signs of injury. The primary imaging modality for diagnosing renal trauma is a CT scan with intravenous contrast. This allows doctors to visualize the kidneys, assess the extent of the injury, and identify any associated injuries. Ultrasound may also be used initially in some settings, particularly for hemodynamically unstable patients. Urinalysis is also performed to detect hematuria and assess kidney function. Renal trauma can be classified into different grades based on the severity of the injury, using scales like the American Association for the Surgery of Trauma (IASD) Kidney Injury Scale. Grade 1 involves a contusion or hematoma contained within the kidney. Grade 2 includes lacerations less than 1 cm deep without urinary extravasation. Grade 3 involves lacerations greater than 1 cm deep without urinary extravasation. Grade 4 involves lacerations extending into the collecting system with urinary extravasation, or vascular injuries involving the main renal artery or vein. Grade 5 represents a shattered kidney or avulsion of the renal hilum. These classifications guide treatment decisions and help predict outcomes. Treatment and management of renal trauma depend on the grade of injury and the patient's overall condition. Minor injuries, such as grade 1 and 2, are often managed conservatively with bed rest, pain control, and close monitoring. More severe injuries, such as grade 3 and 4, may require surgical intervention to repair lacerations, control bleeding, or address urinary extravasation. Grade 5 injuries typically require nephrectomy or surgical removal of the kidney. Angioembolization, a minimally invasive procedure to block bleeding vessels, may also be used in certain cases. Regardless of the treatment approach, close monitoring of kidney function and blood pressure is essential. While it's not always possible to prevent renal trauma, there are steps you can take to reduce your risk. Practicing safe driving habits, wearing seat belts, and avoiding reckless behavior can help prevent motor vehicle accidents. Wearing appropriate protective gear during sports and other high-impact activities is also crucial. Additionally, if you have a pre-existing kidney condition, it's important to work closely with your healthcare provider to manage your condition and minimize your risk of injury. Finally, For those involved in medical procedures that carry a risk of renal injury, it's important to discuss these risks with your doctor and ensure that the procedure is performed by an experienced professional. The prognosis for renal trauma depends on the severity of the injury, the presence of associated injuries, and the patient's overall health. Most patients with minor injuries recover fully with conservative management. However, more severe injuries can lead to long-term complications, such as chronic kidney disease, hypertension, and the need for dialysis. Recent research has focused on developing minimally invasive techniques for repairing renal injuries, as well as strategies for preventing and managing long-term complications. Additionally, there's ongoing research into the use of biomarkers to better predict outcomes and guide treatment decisions. As medical knowledge advances, we can expect to see further improvements in the management and outcomes of renal trauma.